Hello, everybody. To begin with, I would like to introduce myself. I'm Daniel DIACONU from part of the IT department of the Central Military Emergency Hospital from Bucharest. The topic I intend to discuss today is the role of intensive care in the treatment of COVID-19. Let's begin by looking at the contact table, and then I will present each of the topic in detail. I will start with a short introduction on COVID pandemic. Then I will talk about COVID-19 cases, followed by its impact on the healthcare system. And I also reveal the major importance of the intensive care units and modular hospitals in Romania. Before summarizing, I have also pointed out the crucial role of the human factor side in the battle against coronavirus. And I have concluded with the impact of COVID on the Romanian healthcare system. You will be able to see a chart that illustrates the COVID-19 cases split in 4 major categories. The confirmed ones, cured, active, and deceased patients recorded at 17th of May 2021 in my country. Continuing with our next graphic, we'll see that the medical care system was also deeply affected, achieving a number of more than 30,000 cases in the healthcare system this year. Regarding the social context, the authorities constantly encouraged people to stay at home, kept the population updated, and underlined the need for restrictive measures. However, the Romanian army remained the most trusted institution, not only the coronavirus pandemic, but also in general. Next, I would like to introduce the importance of the effort put in by intensive care staff in saving lives. The pandemic came as a major challenge to the entire healthcare system and involved very urgent action by the authorities. Among these, the intensive care units carried the greatest burden and had to embrace a new series of actions, of which I will list. Hospital policies were modified, care was reorganized in terms of procedures, drug supply, decisions, and patient-centered care. Also, hospitals were overwhelmed due to the high numbers of patients versus the available resources. An essential measure implemented in fighting the COVID-19 was the construction of modular hospitals meant to cope with the increasing number of patients. The Role 2 COVID-19 campaign military hospital was the first functional modular hospital in the country. This hospital is from Bucharest. Its structure has undergone changes during operations, aiming to ensure the best possible hospitalization conditions for patients. It was dedicated exclusively to treating patients infected with the new SARS-CoV-2 virus. And the campus of the military hospital, Role 2, IT solutions were identified and applied so that both the patient and the medical team could benefit from a maximum degree of comfort and safety. Personally, I have been part of the team assigned to ensure the IT support for various departments inside this modular hospital, ACP included. It was a life-changing for me from a personal and professional point of view. That has offered me the gratitude of being able to help others in need. Next, I would like to discuss about the impact of this pandemic on the ICU personnel. Intensive care staff faced from the beginning the stress created by the initial disorder. This was caused by the negative impact experienced by citizens, the unusual working condition, and the fear of being contaminated. A qualitative study on the psychological experience of caregivers of COVID-19 patients revealed fear and negative feelings like fatigue, discomfort, doubt, anxiety, worries about their families. Now I will move forward to slide 9. The medical activities in the intensive care unit of the military hospital were carried out on many levels and directions, not only in the treatment of severe acute respiratory failure of the virus. Most patients also had associated pathologies, some pre-existing DIACONU and decompensating episodes, and others were induced by the damage caused by the virus. As a result, we were dealing with patients who required multidisciplinary collaborations and a team approach. And I can conclude the solidarity, the empathy, and the positive mindset of the personnel have contributed to success of winning multiple battles against this pandemic. Now I would like to conclude by saying that COVID-19 as a new highly infectious disease with an uncompletely described clinical course results in perhaps the greatest need for intensive care since services were first initiated. Overall, ICU was developed in response to struggle with the massive influx of patients. The COVID-19 pandemic is a medical and economic challenge for the healthcare system. However, ICU will continue to deliver quality for those most at risk. And that would be all from my side. I would like to thank you for your interest and attention. Thank you.
Thank you, Daniel, for the very informative presentation, and also really liked that you emphasized the psychological aspect, because this is something that ourselves experienced, and it's very important, because this is not something that you can measure or control. This is something that sometimes it's something unanticipated. Are there any questions regarding this presentation? Open your camera, please, if somebody has a question. If there is no question, okay, Nadir.
Thank you very much for the presentation. As you can understand, like everybody, one big problem was the relation between the patients and relatives. And I think also that the biggest problem was the relation among the intubated patients, so the non-collaborative patients, and the relatives. How could you manage this situation? Because in Italy, we had different behavior. Someone tried to have a VTC with the patient that was intubated. In other setting, they avoid to do VTC and they organize only telephone consultant with the physicians. Thank you.
Okay, thank you for the question. We have integrated video system with real-time video system in the ICU wards. Of course, this helped the family in a small way, but the pandemic, the virus was not an easy experience to live, and but we tried to do that. So we integrated a video system in the ICU ward with the patient and with everything in real time. Of course, it was not the first step, but we developed that in a while.
Thank you.
I have a question, if there is some time, regarding tracking of COVID-19 cases, both as you know, as total numbers and also for ICU. Did you have any application or software? I'm asking because, as my colleague Maritina Giannakopoulou said, we have developed ourselves an application. We have to create a custom application to track, you know, all incidents, who is in ICU, who is, you know, to have an outline of the situation. How did you manage to deal with the collection and the sharing of information?
We developed a local application only through this hospital, Modular hospital. And yes, we updated it periodically, but it was not an application for, I don't know, for all citizens or for relatives to the patients. We had it integrated locally.
Yes, okay. I understand. There are applications.
I can explain you more if we have time.
Oh, okay. Just a question.
We really try to introduce telemedicine in at other level in this, especially, you know, to not be contaminated with everything like papers.
Yes.
Yes, but we have something local with real-time updates.
Okay. Thank you. If there is no other question, I will once again would like to thank Daniel for his time and valuable contribution. Senate Secretariat perhaps would like to ask something.
Yes, Theodoros, many thanks.
Yes, thank you.
I'm Lieutenant Colonel from Cachore from Senate Secretariat. I have a question regard to the psychological side, because in the beginning of the pandemic, there were unfortunately a lot of victims, and how the doctors have managed to address this psychological side, because they have a lot of deaths in the beginning, and they have to address this also psychological and also spiritual side. How they have managed this this part?
Indeed, it was a big challenge for everyone, especially the medical staff. As I noticed working in that place, the more experienced doctors tried all the time to motivate the newcomers, and after a while we made some trainings for the whole staff, for the nurses, for doctors, and step by step they succeed in a way to face this challenge. It was continuous work and motivation. Yes, I have seen a lot of cases. There were very bad days when they really gave up. I mean, emotionally, because the profession should be done. But step by step, they succeed fighting with this pandemic and won some battles, because we didn't won the fight yet.
Yeah, many thanks. Many thanks for your service and for your commitment. Many
Welcome.
thanks, Ador.